The 5th International Global Network of Public Health Nursing Conference was held on 14th to 16th May 2019 at the exotic Safari Park Hotel in Nairobi. It was co-hosted by the University of Nairobi and the Ministry of Health, Kenya.
I hope you're going to enjoy the conference over the next 3 days. There are some really exciting speakers. I wish I could clone myself so that I could be in all the breakout sessions. My hope for you is that you come away inspired with the information that you're hearing, that you're invigorated and energized to go back to your own countries and to really bring forward the forefront of public health nursing.
GNPHN is a membership-based network of professionals in public health nursing across the world, currently hosted and headquartered at Institute of Health Visiting in the United Kingdom. The network is governed by an 11-member international council, and its membership now spans 29 countries. This was the very first time the conference was being held in Africa. Over 300 delegates from 17 countries attended the conference. The delegates were drawn from a wide array of public health professionals, ranging from public health nurses, trainers, doctors, and other stakeholders in the industry.
The main objective of this conference was to bring together people or different practitioners of public health nursing, not necessarily nurses, but public health nursing. That means anybody else who is interested in public health or who is taking care of public health could actually join the network. And it was a nice challenge thrown to us when the Global Network of Public Health Nurses Council asked to partner with the University of Nairobi and specifically School of Nursing Sciences.
The university will continue to support such fora like these ones. We'll commit to endeavor to improve the quality of teaching and programs of this university. In this particular case, our nursing science programs.
As a curtain raiser to the main conference, a special public lecture was delivered on the 13th May at the University of Nairobi by Professor Miriam Mwere.
According to the theme of the conference, we are dealing with Sustainable Global Goal number 3, to ensure healthy lives and promote well-being for all at all ages. Therefore, the theme of this conference, which is good health and well-being, is spot on. And if there is any part of the world that needs to pay attention to what the conference is going to say, it is Africa. It's Kenya and Africa.
The pre-conference was also graced by Kenya's first Chief Nursing Officer, Dr. Muringo Kirene.
National public health systems today are struggling to contain the spread of epidemics, some of them not known. We didn't know anything much about Ebola, Marburg virus, and SARS, and these today are spreading across the regions. And yet, the nurses, particularly the public health nurses, must respond, be trained, and be able to respond to these infections.
The conference theme was Good Health and Well-Being, Contributions of Public Health Nursing to Achieving Goal 3 of the UN Sustainable Development Goals.
When you come to a conference such as this, there are outcomes that you expect. So we want to assure you that this conference gives you the opportunity to present all those knowledge that you have generated and also learn from the evidence that is generated by others. And this should help us to chart the way forward on how we are going to use the generated evidence to achieve the SDG Goal 3, which is good health and well-being. We want that from the time we live here, we have very clear time plans and what we are going to implement in our countries.
On the first day of the pre-conference, we had the visits to various environments. There were visits to low socioeconomic neighborhoods, slums. There were visits to hospitals, including where I work, KNH. And there was a group that visited one of our pediatric wards and interacted with the staffs and the children in the ward.
The conference was opened by the First Lady of the Republic of Kenya, Her Excellency Mrs. Margaret Kenyatta. She was accompanied by the Cabinet Secretary for Education, Professor George Magoha, and the Cabinet Secretary for Health, Ms. Cicely Kariuki.
Thank you. In the process of planning, we said who would be our chief guest. And so we eventually said it will be our First Lady of the Republic of Kenya. Why? Because of her Beyond Zero campaign and because the ethos and the pillars of the global network for public health nursing align very well with Zero campaign.
It's with great pleasure that I come here to join you in the opening ceremony of the 5th International Global Network of Public Health Nursing Conference. The theme of this conference, Public Health Nurses Achieving Sustainable Development Goals SDG 3, Good Health and Well-Being, is important to our country, Kenya, to the African continent, and to the world. This theme resonates with my own efforts through my Beyond Zero initiative that seeks to ensure optimal health and well-being for mothers and children.
This conference, which is being held in Kenya for the first time, gives us yet another opportunity to share knowledge, to learn from each other, to expand our networks, and to be able to also put our best foot forward as a country. Thus also be instrumental in enriching our policy formulation, education standards, and international best practice for public health nurses across this country, but also globally.
And so I am here and looking at you at the title of your conference. And I'm saying, since Kenya is also training nurses, perhaps our beloved president's Big Four agenda, which include universal health care, perhaps the nurse is the one with the answer.
This conference is timely because it coincides with the International Nurses Day, which was on the 12th of May, and the National Nurses Week celebrations, where nurses world over are recognized for who they are, the heart of the health workforce, for the sacrifices they make, for the care they give.
Over 100 scientific papers were presented at the conference addressing issues of maternal health, sexual and reproductive health, including FGM, community health practice, communicable and non-communicable diseases, including mental health and nutrition, human resources for health, and the creation of robust systems for health.
Tafadhali, karibu sana. Give him a round of applause.
The keynote speech was delivered by Dr. Givinji Gitahi, the Group CEO for AMREF Health Africa and co-chair of UHC 2030 Global Committee.
Your theme today at this conference is not only linked to health, it is linked to the goal of reducing hunger. It is linked to improving nutrition, linked to universal access to sexual and reproductive health, linked to safe water and sanitation, energy efficiency, climate change, which is the cause of so many deaths that we see today, that without thinking about climate change will not resolve the issues of health. Health systems will only work if we create robust systems for health, not for healthcare. For people, not for patients. For communities, not for particular professions or sectors. This is your role. And by so doing, will have addressed the primary issue of life and death, loyal to your work, and devoted towards the welfare of those committed to your care. It is within your power, and we look up to you. Thank you for inviting me. Thank you.
Other key speakers included Ms. Annette Kennedy, the president of ICN, Professor David Weekliam from Global Health Workforce Network, Professor Dan Kaseje, Dr. Ernest Nyamato, Dr. Barbara Stilwell, Dr. Lucy Kivuti Bitok, among others. Breakaway sessions and side meetings were held to discuss various presentations.
So the mental health category was largely around anxiety, stress, and some people feeling they were depressed.
And discuss in the room for the next 10 minutes or so is about gender-based violence and what that means, so that we can be sure that we're kind of thinking along the same lines as...
Hopefully you've learnt a little bit, a smattering about human trafficking and how evil it is.
Global public health nursing, you can start from the grassroots, like I said. It's the cheapest preventable disease we can see. We can engage the community health workers.
This knowledge might be useful for public health nurses when we are counseling breastfeeding women about nutrition.
Not that palliative care is a human right. Now, why palliative care and what is the burden? What is the need for palliative care? Globally, statistical WHO outlines that we have about 43 million people who require palliative care services.
In the plan of care, we need to understand how the drugs work. If there are interactions and side effects associated with them, some of them may, associate a certain bill with discomfort, and they may not want to continue with it.
At the beginning of the discovery of HIV/AIDS, we know that people were fearing that they're going to lose weight. So, is there a possibility that it is a nutritional?
I concluded that in our setting, that mostly the diagnosis of this birth defect are made after birth. Giving birth to an anomalous child brings feelings of distress.
Dr. Barbara Stilwell, the Executive Director of Nursing Now, gave a detailed presentation in one such side meeting. The session was well attended by the student nurses as well as the younger nurses at the conference.
We are in demand as nurses, and that's very important for us, and it's one of the indications we need to continue to think about what our profession is going to look like in 20 years. Nursing should not be seen as a cost, but an investment. So when policymakers, politicians complain about the cost of employing more nurses, this is the evidence you need to have to show them.
The conference offered a huge platform for learning, sharing, and networking. Many delegates as well as the conference officials were very happy with the conference.
I just wanted to say a few words before you leave. I wanted to thank all the delegates for coming all the way to this conference. Some of you were a little nearer, some of you were farther. We so appreciate your presence at this conference. I want to thank my council, the Global Network of Public Health Nursing. They have done a fabulous job with me for the last 3 years, and I couldn't have done any of it without them. So if I'm successful, it's because of them.
I've met so many public health nurses and managers and educators from all around the world. So it's been a brilliant opportunity to ask all sorts of questions and find out how public health nursing works in many different places.
I appreciated the openness of discussing issues.
I appreciated the variety of issues being discussed. And of course, last night was brilliant with the safari cats and just the collaboration and networking with everyone that was there.
And one important message that I'm taking home with me is that public health nurses are really drivers to primary health care. And it is the public health nurses that are going to contribute a lot to achieving universal health care.
It was an opportunity, one, to share experiences, to know new friends, and three, to have a feel of the studies other people from elsewhere have done for it to be a learning experience for us here in Kenya.
We have shown the world that nursing is a profession that has made strides since where we started with Florence Nightingale.
So nurses have to get involved in policy. They have to work with the legislators. They have to educate. And to me, the key to all problems is education.
I had never before thought that I could get into public health, because I used to think public health is just sitting in an office somewhere and trying to draw up policies, which it is partly, but I've also seen the side that is the personal touch that is getting to actually influence people. So in terms of my career, I'm considering getting into public health.
And the feedback I got from our presentation was very overwhelming, and I would desire that we have more interactive sessions.
This conference was amazing mix of experience, having very experienced nurses, having a mix of the young nurses that we are mentoring, but majorly more so the networking opportunity that this conference has accorded us. It has brought the world and made it a very small place, and a huge opportunity for us as an association, our commandate of professional development. It has given us a lot of opportunities, windows, as we network in areas that we need our members to grow professionally.
For the partners, I would want to tell them this. What we are doing is a synergic effect. Whatever we are working on actually supports their work. We are able to propagate that which they want to propagate, and we are able to meet people at different levels. We have inroads. Why? Because more often than not, people will trust people they know. They'll trust their own.
Well, we really want to thank those who came on board for us, because without them, this wouldn't have happened. People who had to pay their own air tickets from Japan, from China, from Ghana, and wherever they came, even those Kenyans who came from the counties paying their own transport. It was a great support for our conference.
The delegates also had an opportunity to sample the finest of Kenyan cuisines as they enjoyed the tantalizing entertainment from the famous safari cats. At this event, the GNPHN Africa chapter was launched. Various organizations and agencies partnered with the GNPHN Secretariat to sponsor the event. Key among them included IPAS Africa Alliance, USAID, HRH, Kenya Mechanism IntraHealth, AMREF Health Africa, and GPAGO. Also partnering with the GNPHN were several professional nursing bodies like the Nursing Council of Kenya, National Nurses Association of Kenya, the East Central and Southern Africa College of Nursing, and the Progressive Nurses Association of Kenya. An air of ecstasy engulfed Jambo Hall as the conference came to an end. The participants let their guard down in the scintillating Mzuka dance. As the curtains fell on the GNPHN Conference 2019, it was clear that it is imperative that public health nurses need to regain their voice and take the lead in the realization of the global agenda on sustainable development goals and universal health coverage.
Okay, let's go.